Hi, everyone. My name is Liz Talbert, and I'm the Executive Director at the Alliance for Safe Kids. In light of our current situation, our 10th annual Save a Life Forum had to be postponed, and we made the decision to continue to provide the community with valuable resources and information virtually. So I'd like to welcome you to the first edition of the Save a Life webinar series. This session will focus on managing stress and anxiety during COVID-19 and will be presented by Stephanie Carbone. Stephanie is a Yorktown resident, a licensed clinical social worker who has worked for over 30 years as an individual and family therapist, and an avid volunteer with Ask for as long as I can remember. Before I turn things over to Stephanie, I would like to share a few housekeeping items with you. The webinar is being recorded and will be emailed to you along with the PowerPoint, so please don't feel as if you have to write down all of the information that's on the slides. The chat room that you see on the right of your screen will be set to private once the presentation begins, and you may add any questions that you have there. Stephanie will answer questions at the end of her presentation, and all questions and answers, even those we may not have time for, will be emailed to you. And the image you see below our picture may be made larger by simply dragging the line up, and that will allow the presentation to be more prominent on your screen if you so choose. I now have the pleasure of introducing Stephanie Carbone.
Well, thanks, Liz, and thanks to all of you who are joining us today. I think it can be really reassuring to gather as a community during this time. And today we have people from our ASK board, we have community leaders joining us, school personnel, many families and community members that are here so we can all connect together. What I did want to do is maybe retitle this program and call it Continuing to Manage Stress and Anxiety During COVID and continuing to find calm and resilience during challenging times. We're 2.5 months into this now, and certainly we have had our moments of stress and anxiety, and maybe have found moments where we become a little bit more tolerant and may be able to manage our stress a little bit better. So keeping that in mind as we go forward today, we've been doing this for a while now. Before I start getting into the bulk of the presentation, I'd like to start with a quote by Brené Brown. Brené Brown is a professor, a lecturer, an author, a podcast host, and she has been doing research down in Texas for decades around vulnerability and resilience. And she says this pandemic experience is a massive experiment in collective vulnerability. We can be our worst selves when we're afraid, or our very best, bravest selves. In the context of fear and vulnerability, there's often very little in between, because when we are uncertain and afraid, our default is self-protection. We don't have to be scary when we're scared. Let's choose awkward, brave, and kind. And let's choose each other. So throughout today's talk, you're going to be hearing me use words such as vulnerability, fear, uncertainty, and I wish I could have said this any much better. I couldn't have said it much better than Brené Brown. As we have gone into these 2 months together, we've been hearing we're all in this together. There's this new normal. We all have had a continued disruption in each and every one of our lives. So maybe we've had an opportunity to see this pause as a place where we've learned a little bit more about ourselves. Maybe we've learned a little bit more about our relationships or about our communities. Certainly on a global level, we have realized the significant impact that COVID has had on our marginalized and our indigenous populations, as well as our elderly and those with compromised immune systems and their families and all those who've been affected. I'd like to think that we learned a little bit more or continue to learn a little bit more about compassion for ourselves and others. And maybe we've actually, like I said, realized some of our own strengths and resilience and coping skills that maybe we never realized that we had, or that we had internalized before COVID-19. And we're adjusting. We're continuing to adjust, and we're going to be doing so as we continue into the phases of reopening as well. And as we continue to go into the reopening phases, we might be feeling different stresses or different levels of anxiety. They may look different from what we've experienced when we first started this together. So in this next hour, we're going to be talking specifically about stress and anxiety as it's related to COVID. We're going to address a little bit about bereavement and loss. We're going to talk about how we can enhance our coping strategies, maybe learn new ones that we never knew about before. And just as important, we're going to learn how to and continue engaging in our own self-care and how to support others during this time, especially as we go into the summer and fall months. So a few words about stress and anxiety. What I do want to say is I spent some time training with the emotional support hotline with the Office of Mental Health in New York State. And a lot of these points that I'm going to be making today come from some of that training and how we've all been impacted specifically by COVID. But a few words about stress and anxiety. Stress is your body's reaction to change, demands, or difficult situations. It's a part of our everyday life, and obviously too much stress can have a negative impact on our daily life. But it is a normal, proportional reaction to external pressure or worrisome situations. Obviously, this is what we've been experiencing with COVID. It can show up in our body in various ways, including increasing heart rate, shortness of breath, difficulty sleeping, and anxiety, like stress, can also have those similar reactions in our body. Anxiety is a natural reaction to events or situations that are frightening or stressful. It is excessive worry and sometimes fear that interferes with our day-to-day life. And the anxiety, obviously, that we've been maybe experiencing with COVID is clear with this excessive worry maybe that we've been experiencing. It can happen when something causes you to learn to be scared and worried, and it can affect both, obviously, your thoughts and your body. So stress and anxiety reactions to COVID-19. We're talking about a reaction to an infectious disease crisis. A crisis is a perception or experiencing of an event or situation as intolerable, exceeding current resources and coping mechanisms. It's a time where we're experiencing more than simple stress, okay? It's at the same time, it's not mental illness, but some of our stress and our anxiety can be extreme and feel very strong. A global pandemic, everyone here is affected in some way. And we talk a little bit about collective vulnerability, like what Brene Brown was talking about. We all are experiencing some sort of vulnerability and disruption. So there are a range of reactions during a global phenomenon like COVID. We've already been through the initial reaction. We're talking about a crisis. This is overwhelming. Over time, we're hoping that our natural resilience will get us through this and support some of our recovery and growth. Some of us are going to survive the crisis, but block it from our awareness, and that can maybe cause future problems. Some of us are going to break down and maybe even put our life on hold and get to the point where we really need extra support, maybe engage in therapy and engage in some of those hotline supports because we're just not managing as best as we would like to. Most of us are going to be returning from this pandemic with newfound and even newly realized coping skills and reminders of our resilience. And 2.5 months in, maybe we're already realizing some of those resiliences. There are reactions by type when we're talking about stress and anxiety. I've mentioned the physical reactions. There's an increased heart rate. People are more fatigued. Some people feel weak. The cognitive reactions, we're feeling uncertainty still, right? Poor concentration, feelings of disbelief, a lot of rumination going on about what's going to happen in the future, for example, next phases and next steps. Spiritual reactions, people are questioning their beliefs. They're questioning their houses of worship, their body of worship, and maybe this is not, I'm not going to be finding support where I need it in my spiritual home. Emotional reactions, from apathy to irritability, a lot of panic, maybe some denial, some feelings of hopelessness and helplessness as well. And of course, the behavioral reactions. You see blaming, you see people are blaming other countries, they're blaming politicians. In addition to difficulty eating or sleeping, there's withdrawal, increased conflicts with our friends and with our family members. And there's even been an increase in alcohol use and substance use. People are trying to self-medicate, trying to find a way to cope. All normal reactions. And again, there are these different levels of stress that may occur. You have that actual stress about this disease. Am I going to catch it? Am I going to spread it? How am I going to deal with the symptoms? It's out there. There's the level of stress associated with the disease when it comes to loss, personal loss and disruption in our lives, but also personal loss. People have lost loved ones, and bereavement, and the psychological loss of feeling uncertain. The disruption to our normal life is another type of loss. And so even if we may not even be directly affected, nobody is left untouched by this. Every day, life has been interrupted for all of us. Huge amounts of disruption. As we support others and ourselves, it's important to be very thoughtful and to validate that there's no competition here whatsoever as to who gets to have the strongest reaction. We're all feeling some kind of strong reaction, and whatever we're feeling is important. Very important to acknowledge that with ourselves and with our loved ones. Again, the particular stress reactions in response to a pandemic, we've gone over a couple of them: fear, worry, stress, anxiety, fear of the disease. This virus is invisible. This fear is continuing with us. And especially, again, as we talk about reopening, the physical that we mentioned, the racing heart rate, the tensing of the muscles. Then there's this hyper awareness of whether or not we have the illness. I have shortness of breath. Does that mean I have COVID, or is that anxiety? And what do I do with that? We have stress about access to care. We're over the peak, thankfully, in New York. But we're still wondering about healthcare, and is it okay to go see my doctor for non-COVID related issues? Just worrying about that access to care. Of course, we have fear about our own and our loved ones' health. And something else that I really want to talk about is guilt. Some people have actually talked and used the word survivor guilt. Some people are feeling guilty. They're feeling like, I haven't really been that badly affected by COVID. In fact, I've actually kind of benefited. I didn't like my job, or I didn't like my commute. Now I get to do this at home. I have an opportunity to reassess what I want to do with my life. I'm getting unemployment checks. I'm actually doing okay financially, maybe a little bit better because I'm not commuting, for example. So there's a lot of feelings of guilt. All of these reactions should be considered valid and respected. A little bit more about stress and anxiety. And again, even as we're going into our reopening phases, people are still having difficulty assessing risk and making decisions. Now that we're reopening, still, do I wear a mask if I'm walking by myself on the sidewalk? Is it really okay when they open the hair salons? Is it really okay to go get my hair cut, to go hang out at the beach, even if I'm socially distancing? Is it okay to have that play date, even if I'm socially distancing? So being unable to assess the risk, even if they're listening to the scientists, has been creating stress and anxiety for people. Of course, the uncertainty about the timeline and the stay-at-home orders, again, reopening. How long are we going to be having to do this? What's going to happen in the fall with my school and college? Are the airlines going to be reopening? Is it safe to fly? And then very important is the significant grief about expected events or milestones that's still happening. We're talking about events that are part of our narratives about our life. Our weddings that we had planned, graduation ceremonies. We're talking about real grief about the stories that you had written about yourself about these events. We don't have our usual respite. We're still working from home. Work can be respite for people. It gives us a change of scenery. We like spending time during the day away from home, chatting with colleagues, working closely in person with colleagues. Weekend trips that we might have used in the past as a respite, people aren't necessarily going to their vacations home right now. Childcare is a respite. So, and for some of us, the days are still blending together. Again, even as we talk about reopening, this is still very happening a lot. And these unhome safe situations, they may be escalating, the domestic violence, the possible child abuse. These are levels and experiences of stress that are continuing. A little bit about bereavement and grief. And honestly, we could do a whole workshop just about that. But when we talk about bereavement and grief, those of you who've lost loved ones even before COVID, you could probably relate to some of what I'm about to talk about. But grief can bring on a range of emotions, surprising, confusing, sometimes intense, sometimes mild. Keeping in mind that grief thoughts and behaviors differ from person to person. Grief looks different for every single person, even from the same family. We're grieving the person who died. We're grieving the person who we've lost, and the idea of the future that we actually were going to have with that person. That's all part of this loss that we're dealing with. The range of emotions, sadness, shock, guilt, anger, and even the yearning of wanting to be with that person that we've lost. The inability to complete traditional rituals during the pandemic, and we're continuing to experience that as well. Not being able to attend funerals or memorial services. Rituals have a healing property. So there's a big part of this loss that we're missing out on when it comes to healing. Survivor guilt, we've talked about. Why was I spared? And then we have the family members who are just devastated, frustrated that they were not able to visit their loved one who was in the hospital, or certainly be with that loved one when they passed away. That can linger for a while. It's just very difficult and significant loss. Considering loss and acknowledgement, I like to use the word acknowledgement when we talk about loss. It's okay to not be okay. Even if it's just the loss of disruption of life and just or disruption of our normal life. Whatever the loss, it's important to let that person that you're supporting be in pain. There's no need to give advice, such as look on the bright side or this was God's plan. You can't heal someone's pain by taking it away from them. It's so important to remember that. Letting things hurt, being heard helps. Acknowledgement can be the greatest healer. And letting the pain exist when you're sitting with that person shows that you were there to join in and to validate. There's no need to fix, nothing to do really but to listen. I will say that I think during this time, this global pandemic, where this has been a sense of global loss, I do think that we're, as a world community, are learning a little bit more about bereavement and maybe even learning to talk about death and grief in a more familiar way, which I think can be encouraging. And I think we've all, again, globally, have maybe begun to have a better understanding about the grief process as it's around us, all around us. Again, not being dismissive about loss and the disruption of loss, but talking about finding the positive after loss. And even again, those of you who have experienced loss even before COVID, trying to see your experience as strength and going through loss and learning to carry on helps give you the skills to deal with tough situations in the future. That doesn't mean that you're not really sad or mourning now. But it does sort of help you tap into maybe some strengths about being able to carry on in the future. People are learning from each other. There's more support groups than ever, I believe, out there during COVID. And joining these support groups and even online, which have been created also online, and not being afraid to ask for help can be very empowering. Looking for opportunity amid the adversity. Loss opens up possibility for new experiences and the chance to start over in various areas of your life. Again, it's not going to happen right away, but this is an opportunity to see how you can do starting over. Remembering the good times and leaning into the joy and the memories of the past that make you happy. Gratitude arises and it can help heal. It's okay to lean into a little bit of moments of happiness. It's okay to do a little bit more of what makes you happy. That is also part of your healing. And finding ways to honor your loss. People have found other ways to memorialize their loved ones during this time of COVID, maybe more other creative ways, if they can't be there in person, to mourn that and grieve that loss. So the role of uncertainty. Obviously, life as we have seen it can change very quickly and unpredictably. As human beings, we crave security though. And we want to feel safe. We want to have a sense of control over our lives. That's what makes us human. Many of us use worrying as a tool, though, in an attempt to predict the future. It makes us feel like we have some control over uncertain situations. So if we keep worrying, we're making ourselves believe like, I'm going to come up with some solutions and this is actually going to be good for me. It's helping me think about the future. But honestly, chronic worrying can't give you control of external events, and it keeps you from enjoying the present. It keeps you from staying present. We're going to talk a little bit more about worrying when we talk about coping skills in the next few minutes. And again, learning to cope with uncertainty. You can maybe consider your own experts at this point. 2 months, 2.5 months in, you've already maybe been learning and doing okay coping with the uncertainty. Some ideas though is to continue to focus on controlling those things that you do have control on. Challenging the need for certainty. Why do I need to know? You can better learn to tolerate and even embrace the inevitabilities that life can bring us. We're learning about our uncertainty and how we're even coping with it. And as a global community, really our primary task to practice right now, all of us, is uncertainty. And the more you practice sort of leaning into uncertainty, we'll again talk about some coping mechanisms to help you do that, the better you can thrive. And we're all learning really without choice how to be comfortable with the uncomfortable or unknown. Some of us are doing a little bit better with it than others. But talking about our well-being during these times of uncertainty, we're trying to make meaning of where we can't make sense. This pandemic is senseless, right? Tragedy is always crisis. Tragedy, it's always senseless, right? So what do we do with it? And how do we position our minds? And how do we make this experience manageable? Some thoughts that you might want to think about is if you were to look back a year from now, how do you want to say that you handled this crisis? We're experiencing history in the making, and you're living through it. What can you say about how you did your best during this time of history? Very powerful. And if you were to redefine your life based on what you've learned during this time, what would that look like? So these are maybe some thoughts and ideas to think about as you lean into coping with some of this uncertainty. And continue to. Pema Chodron, who is a leader in mindfulness meditation, says, "It's not a terrible thing that we feel fear when faced with the unknown. It is a part of being alive, something that we all share." Really going back to the idea of collective vulnerability, we're all feeling some level of discomfort, disconnect, disruption. And there's a lot to be said about mutual support, whatever that looks like for you in your life. support groups can be very powerful and empowering. The mutual support is something that we all share. So we're going to be talking a little bit about effective strategies. This is a list that I've come up with. You probably have some of your own that are similar or maybe differ that you can share with others. Getting enough sleep, taking breaks during the day, eating a healthy diet, connecting with others. You've probably already been doing all these. Moderating your TV and media and news exposure. Doing some deep breathing or mindfulness. We're going to go into that in a little bit. They're learning new coping skills. There are tons of phone apps there now that can help you with that as well. Watching your favorite movie, Netflix, exercising, allowing yourself to receive as well to give, taking care of pets or plants. A lot of new puppies out there. There's been a lot of adoption of new puppies and kittens, and I think that's a great coping mechanism to sort of distract you and get you through some of your days. Using your spiritual resources, whatever that means to you. Balancing work, play, and rest. Engaging in gratitude practice. We'll talk a little bit more about that. Reading, writing in a journal, connecting with nature, listening to music and podcasts. There are lots and lots of podcasts and free online classes out there trying to accommodate the needs of us out there. Again, not to be repetitive, don't underestimate the basics. Self-care and the basics of self-care. We've sort of gone over all these, including, again, staying hydrated, eating well, physical activity, getting up in the morning and bathing and making, creating this daily routine, continuing some routine and shaving and making sure you get dressed for the day. These are pretty basic. Don't underestimate the importance of it. So I'd like to spend a little bit of time talking very specifically about these coping strategies that I think if you don't already have them in your repertoire, maybe you can, add these to your stress-free toolkit or toolbox. And I'm going to start with breathing exercises and talking about how important it is to take breathing breaks during the day. And some of this is very self-explanatory and maybe obvious, but I'm going to go through a few of them. And I'm going to sit for this purpose, but if you want, as we're talking, you just stand and you take a deep breath while you're raising your arms slowly over your head. And then you exhale as you lower your arms. And you can try that again, taking a deep breath in, raising your arms slowly over your head, and then exhaling as you lower your arms. Just taking that 2 seconds to do that little exercise. Maybe you feel a little something different in your body or in your breath or in your breathing. 4-7-8 breathing is also been proven to help self-soothe. So you breathe in through your nose for a count of 4. You take in your breath through your stomach and you hold then your breath for a count of 7, and then you release through your mouth with a whooshing sound for a count of 8. So you breathe in through your nose, count of 4, hold your breath, count of 7, release your breath through your mouth for a count of 8. Some people have a hard time holding on for that count of 7 or releasing for 8 seconds, so you can modify any way you want. Some people try 4-4-4 breathing. This is your practice. Whatever works for you. Belly breathing is being taught in preschools now. It's very simple, very easy to remember. You just breathe in slowly through your nose, allowing your chest and your belly to expand, fill up with air. And then you breathe out slowly through your mouth. And then you repeat. You can do that a couple times. You're finding yourself during the day getting caught up with some thoughts or ruminating. Just take a moment, breathe in slowly through your nose, and then gently out through your mouth and repeat. I like to talk about breathing exercises and the beauty of the breath. The breath is always with us. It's natural. It's a part of us. We were born with it. And you don't need any expertise or background in learning how to breathe to relax. And the breath is something that is used to help us stay present and to sort of refocus. So if you find yourself thinking about something that's upsetting, take a moment to do maybe one of these breathing exercises, and just even for those few seconds or for that minute, you have an opportunity to pause and sort of regroup and focus back on the present moment. Distraction exercises are a great coping tool. Distraction exercises help interrupt this rumination that you might be having, this train of thought, these thoughts that aren't serving you. So when I'm advising students or family members, I'll maybe teach them about these distraction exercises where you can pick a color. Let's say it's blue. You look around the room and then you name everything in the room that's blue. Or you pick a category like food or an animal, and then you go through the alphabet without pausing and then name examples. A is for apple, B is for banana. And distraction exercises have been shown to help regulate mood and emotion. And again, it gives you an opportunity to just stop thinking for a minute about whatever it is that's upsetting you and just distract yourself in the moment and sort of regroup. Grounding exercises, particularly around sensations, has been another very effective way to sort of self-soothe, and we tap into our sensations. You can pick up an object and hold it, notice how it feels, and just pay attention to that object in your hand. Drinking a warm or cold beverage, notice how it tastes and how it feels, and how it feels as it's going down your throat. Or getting a small snack and noticing what it looks like, putting it in your mouth and seeing how it feels in your mouth and as you swallow. And it is, even as you're doing that or thinking about now as I'm talking about it, you've distracted yourself away from maybe some upsetting thoughts, and you're tapping into your sensations and your body, which are a part of you and always with you. A sensory toolkit, adults and kids alike can sort of create one. And again, you have something from each of your senses. You can have something that you can touch, a stuffed animal, a weighted blanket, a stress ball, any textured object that you can keep with you. I advise students to carry like a soft stone that they can keep in their pocket and just rub it during the day. If they're finding themselves getting distracted with thoughts, then they can focus on the feeling of that stone instead. Things that you can taste, hot chocolate I wrote, cold beverages, non-alcoholic, please. Pieces of chocolate, candy, and focusing on what that tastes like. Smell, lighting the room up with candles, or using essential oils that you can tap and place on your wrist, and smelling and using that smell to soothe you. Sight, having a calming scene or pictures on your desk or on your laptop can be very calming and soothing. Hearing, listening to relaxing music, some chanting, some people like to chant, or just sitting outside in nature and listening for the sounds of the birds, or the wind passing by. And I always like to add a 6-1 movement that can be very soothing. Rocking chairs, swings, the back and forth. And again, these are opportunities to sort of disrupt any rumination or nonstop thinking, and it serves to sort of give you that pause during the day. One more grounding exercise that's been very popular and helpful and easy to remember is 5, 4, 3, 2, 1. You work backwards, counting from 5, and you list to yourself 5 things that you hear, 4 things that you see, 3 things that you can touch or feel, 2 things that you can smell, and 1 thing that you can taste. And again, this is something very easy to remember. It's always with you. So if you find yourself beginning to ruminate or your thoughts are going from 0 to 100, begin this grounding exercise. And it takes, again, it gives you an opportunity, a pause to sort of stop that thought process. It can get exhausting to always be thinking. So if you're listening and paying attention to your senses, you're not thinking so much as feeling and experiencing. One last exercise that has been helpful when it comes to self-soothing and decreasing stress is something called progressive muscle relaxation. And it can be practiced anywhere, even in a chaotic or loud setting. So as human beings, when our stress is high, our muscles tense automatically. We're ready for action, right? So with progressive muscle relaxation, we are purposely tensing and relaxing our muscles. And it sends a message to your brain to become mentally calm. So before you start to tense because of stress, what you're going to do is you're going to take control of your body and the tenseness, and you start progressive muscle relaxation. You begin with your lower limbs. You tense your legs, toes, feet, and your lower legs. You tense them for 8 seconds and then relax. And then you tense your chest and your abdomen muscles. Hold for 8 seconds and then relax. Moving upwards, tensing your arms, your shoulders, your neck, and your jaw. Tense and then relax. And then you finally tense your face and again your jaw. Any place where you can find control during a time of day where you're feeling stressed out, you can do these exercises. And again, with progressive muscle relaxation, you are in control of your body and how your body's reacting. Some cognitive coping strategies for working on protecting our minds and taking control over our thoughts. You probably hear a lot about gratitude. Gratitude has been shown to be very helpful in dealing with difficult thoughts. And some people have a gratitude journal, which they keep by their bedside, maybe at night and before they go to bed. So the last thing they think about or do before they go to bed is write down 3 things that they feel grateful for. For kids, we've taught them to make gratitude jars where they have a jar and they have little pieces of paper, and whenever they feel moments of gratitude or something that they're thankful for, they write it on a piece of paper and keep it in the jar. So you can imagine after a week of writing moments of gratitude, just the visual of that jar that's filled with these pieces of paper show you that, wow, there's actually some hope and things to be thankful and hopeful about. Also, small positive moments lists you can do during the day, various times during the day, and write them down. So it's sort of, you can be aware of it throughout your day. And it could be anything from seeing a beautiful sunset, if looking over the river, or, that great grilled cheese sandwich that you made for lunch that was really good. These just small positive moments. Actually, the more you have positive thoughts over time, it actually changes the chemistry in our brain. Worry time. Remember what I said about people use worrying as a coping mechanism. This is a different idea when it comes to worrying. And it's what you do is you set aside a time of day, only 15 minutes, where you are deciding and prescribing time to worry. And I actually teach this to adults and kids alike. 15-minute time slot. I'll say 3 to 3:15 in the afternoon. So during the day when worries come up, you redirect your anger, your anxieties, and your ruminations to that time. And it's a way of setting limits on your anxiety. Remember, I said earlier that people think that worrying is a coping mechanism. The more they worry, they're going to come up with solutions. This is really a way to just keep those worries to a concentrated time, so the rest of your day is freed up to maybe enjoy it a little bit better. Still knowing that you get to have those worries and have that worry time, but just in a limited time period. Obviously, finding a COVID-free space during life can be really helpful. Maybe you've already done this, text chain with friends. But when I talk about non-COVID dinners or times together, spending time together where you're not allowed to talk about COVID or consequences or what's going on or the future about what's going on with this pandemic. And affirmations or mantras are very helpful. And you can create your own that work for you. But they're reminders that this is temporary, such as this too shall pass and one day at a time. And again, not to minimize. We're still going to have our bad days. Some days are going to be better than others, but it can get exhausting to constantly be worrying and thinking. And concerning worry, by the way, worrying is a habit. It becomes a habit. And like any habit, the more you do, the better you get at it, and the more that you find that you're going to be doing it. So trying to tap into some of these coping strategies can be really helpful during this time. But as we're talking about cognitive and thoughts and our mental well-being. Really important. Cutting yourself some serious slack. Most of us are probably not at our best moments from time to time during this pandemic. We're living with this uncertainty. Our routines are disrupted. Maybe we're noticing that we're short-tempered and easily annoyed. I know that's happening probably in every household. But giving yourselves and others a break, taking a pause and reacting, maybe even counting to 10 before you say something, if you're finding yourself getting really agitated, and continuing moving forward as we go into the reopening, continuing to give people a little extra room to make mistakes, forgiving yourself actually for making your own mistakes, and remembering that this is all new territory. None of us has been through this before. I want to make sure that we have time for Q&A. I'm going to go quickly through sleep tips, and maybe you've heard about these in the past, even before pre-COVID. Keeping a sleep routine is very important. Waking up and going to sleep at the same times each day. Minimizing food, alcohol, caffeine, and exercise before bed is very important. Making your bed and nightstand screen-free, much easier said than done, but trying that. Making the room dark, cool, and comfortable. You want to minimize naps if possible during the day. Maybe trying a guided meditation or relaxation practice that we just learned about. If you're not able to fall asleep, getting out of bed and doing something else that's screen-free and trying again later. And research has shown that 4-7-8 breathing, or if you need to do 4-4-4 breathing, is also very helpful in trying to relax the mind and body and helps you fall asleep. Nostril breathing is another one that I recently have started teaching people, where you close your right nostril and you breathe in through your left nostril, and then you breathe out through your right. So you breathe in through your left nostril and out through your right. And this has been shown to help soothe and relax the mind and body. And if you haven't already done so, creating, in addition to all these coping strategies, creating an action plan. That means taking any action during your day to help you restore equilibrium and to feel more power and a little less helpless. And I'm sure by this time, 2.5 months in, you have your own action plan. Here's some of the examples maybe that you've already even done. A symbolic action, putting up a flag or putting up a sign on your front lawn or changing your profile picture. A preparatory action is creating or recreating your schedule for you and your family. That's going to probably be changing even as we go into reopening. Supportive actions. You can still donate blood, shopping for an elderly neighbor, calling someone who's isolated, dropping off food at the food pantry. And my favorite still supportive action that you hear about is the 7 p.m. New York City nightly applause for the healthcare workers. It's something that helps us feel a little bit empowered, maybe not so helpless, no matter how big or small that these actions are. Staying connected with others and remembering to be intentional about cultivating hope and moments of hope. Hope is actually considered an action-oriented strength. So just being there for someone can sometimes bring hope when all seems hopeless. So we're going to talk a little bit now, you as the helper, helping yourself, of course, but also being there for others and helping reinforce strengths and positive coping strategies. Acknowledging that person's strengths and competence and giving them credit and courage for reaching out if they're really going through a tough time. And inquiring about their coping methods. Certainly they've gone through tough times even before pre-COVID. What in the past has helped you get through tough times? How have you gotten through difficult moments in the past? And what skills do you have that will allow you to get through this? Is there any other skill that you might be willing to try? By listening and sort of repeating back to them what they're saying, it helps reinforce their strengths and reminding them of not just their strengths, but some resilience that they may already have. That's not to convey, of course, judgment for the strategies that they're telling you about, unless, of course, they're telling you that their strategies can be harmful to their physical and mental well-being. But whatever works, works. It may be the best strategy in the moment that they have, and supporting that. Continuing to listen deeply and compassionately, just like when we talked about with loss. Listen with your full body and listen without thinking about how you're going to respond. You want to be totally present. Continuing to ask open-ended questions that I just mentioned before, and not comparing. Let that person tell their story. You may have a similar story that you want to talk about. You'll have your turn later. Being there just to let them tell their story and not judging. Again, it's their story, it's their narrative. And you don't have to try to fix them. You know, they're not broken. Continuing to remind them of their strengths. Letting their anxiety be, letting them know, reminding them that they can be anxious or scared or freaked out with you, and that you're not going to try to talk them out of their feelings. You're just going to be there, acknowledge. Keeping them company, which I'm sure many of you have been doing already, and not assuming. Asking people if they want you to be and stay with them. Asking them if they need something from the store. And understanding that anxiety, fear, and worry look different on everyone. Validating, acknowledging their feelings. It's okay, you want to check in regularly, but always remember to hold your own boundaries and remembering to take care of yourself as well. Self-care is very important. You want to also know, though, when more serious help is needed. And if that's the case, you want to connect them with resources and professional support. Really, your compassionate support, maybe it's wonderful. It just may not be enough to support that person. So you can say, if you're hearing them talk about maybe hurting themselves or sounding so distraught that they don't think that they can manage any longer, or they're talking about self-harm, you can say something like, you know, it sounds like you're really struggling. I want to make sure that you have the right support. I'm still going to be here for you, but maybe we can connect you with the hotline that's always available 24/7 whenever you're feeling distressed. Certainly, if they're saying things that are worrisome and make you feel like their imminent safety is at risk, you do want to stay with that person. And if necessary, you may need to call 911 or take them to the nearest emergency room. And also keeping in mind and thought the levels of abuse and neglect, people who are coming from homes where there's already been some domestic violence or neglect and abuse. These families are isolated in their homes. And again, they don't have the daily support of their colleagues, teachers, or friends that they usually would have. All this being said, my favorite word that I like to talk about a lot is resilience. And as we've been confronted with this crisis, this pandemic in our lives, we can continue to allow it to control us and traumatize us maybe, but we've also maybe by this point learned to thrive a little bit in the face of adversity. And maybe we've even seen some opportunities where we've been able to bounce back after kind of a bad day. So keeping in mind, again, resilience, ways to build physical resilience. We've talked about exercise, diet, sleep, taking care of your body, building emotional resilience, meditating, which could be another whole other workshop, challenging your mind, doing puzzles and word games. This can build emotional and mental resilience. Building emotional resilience, sharing your emotions, talking to people, but also being a mindful listener. And as well as building spiritual resilience, staying connected with the community. If your current spiritual community isn't working for you, maybe finding another one. There's a lot going online where you can find some support there. And the more we work on building resilience and tapping into all these different opportunities in the face of adversity, the quicker we may be to bounce back. Keeping in mind, we're still going to have those off days. As we're slowly reopening, just a few more tips about re-entering this world that is still going to be inhabited by COVID-19. Be realistic about expectations. It's okay to keep them low, okay? Things that were once relaxing might now cause anxiety. Taking a walk in the park, even if you're taking precautions, still might cause some anxiety. Be realistic, and forgive yourself if you're feeling low and negative about these expectations. Giving it a try still. People are still going to be wearing masks. They're going to be social distancing, but also recognizing the things that have been protecting you and the people who've been keeping you safe up until now. That is going to continue. You're going to have your doctors, your nurses, your hospitals are available. They're even more prepared than ever to take care of you and your loved ones if something comes up. The essential workers are still out there. They're sanitizing the stores. They've been helping keep you safe. Continuing to give yourself permission to tune out, maybe limit that news and media time to just a short period during the day, but also using this time as an opportunity to re-examine the activities that you were engaged in before the pandemic, and looking at what maybe you've discovered, possibly other interests or skills that you just that you'd like to explore, that you've maybe discovered over these last 2.5 months. It's a chance to push the reset button and restructure your daily life, still as uncertainty continues, and remembering to tap into those strengths and those coping mechanisms. I have 10 top survival tips. You can create your own list. This is sort of a summary of what we talked about. Some of my more favorites, again, are getting outside at least once a day, continuing to give the benefit of the doubt and the wide berth, respecting each other's retreat space, keeping those expectations low, noticing the good in the world. That can be very helpful and healing, allowing yourself to lean into some joy and humor in the day. It's okay to do that, and also very healing. And again, finding something that you can control in your daily life, in your little corner of your world. And just as important, reminding yourself daily that this is temporary. So we began today's discussion with a quote by Brené Brown. So I thought it would only be appropriate to end with a quote by Brené. And she says, "Every time we allow ourselves to lean into joy and give into those moments, we build resilience and we cultivate hope." Again, we're going to have those moments. We're going to have those moments of uncertainty, maybe some fear and vulnerability, and that's okay. But we're also going to have those moments where we can lean into some joy, find those small positive moments during the day. And when we do a little bit more of that as well, we are going to build some resilience and cultivate hope if we haven't already. So this is a very quick resource list that I have, and I have references on the next page as well that you can refer to, and that Liz and ASK will be posting on the website after we're done today. I'm going to hand this back to Liz now.
So much, Stephanie. That was really wonderful, a wonderful presentation. We do have some questions that came in from the attendees. So here's one of them. How can you boost morale amongst family, coworkers, and peers? School-age children and elderly people seem to be missing the social interaction more so than others, and it seems to be impacting their overall well-being.
Okay, so really, as we've discussed earlier today, reinforcing those strengths and the coping skills, continuing to listen deeply and compassionately, acknowledging their feelings, giving them their space, letting them talk about their sadness and their anxiety, reminding them of their resiliences, remind them that they can connect through other ways with people via, text, social media, phone, and even visiting someone, even in a nursing home, visiting them outside their window or outside their home or from their driveway.
I deal with friends or family members that may have different views from me about safe practices during this time without it turning into a fight.
Well, I'm sure everybody listening today could guarantee that there have been fights and conflicts in their homes and maybe in their social settings that have been socially distant. There are going to be times maybe where you can just create these non-COVID-19 spaces and conversations where you agree actually not to talk about it. You also can agree to disagree and just move on, and allowing each of these members to practice what they feel most comfortable with, as long as it's not putting them at great risk, and saving your energy for your own self-care. I do want to add, there has been an increase in alcohol use. I think people have been using that as a form of coping. Being mindful of your use, because when we drink and we're under the influence, sometimes our mood and our emotions can fluctuate. We tend to react maybe with a little less caution or with a little less filter. So keeping that in mind. Of course, giving each other the benefit of the doubt, keeping that wide berth, respecting each other's opinions, again, without taking any comments personally, and sort of leaning in with curiosity and kindness as they talk about some of these issues, keeping our judgment at a minimal and hopefully to ourselves, and also communicating in person. I think when people start saying things over text or on social media, they can be misinterpreted and misunderstood, and the point of support maybe is not getting across. So those are just a few ideas.
And helpful information. But in the interest of time, we'll manage all of the other questions that came in during the webinar after it. I did mention at the beginning that we will share all questions and answers in the follow-up email. So I'd like to say thank you to Stephanie and to all of you for taking the time to attend this webinar on such an important topic. I hope that you learned some new tools and strategies that may help you and help you to support those around you as we all navigate this difficult time together. I wanted to share some additional information about an interactive guide that ASK created in collaboration with the town of Yorktown. It's called the Yorktown Together COVID-19 Resource Guide. The guide offers information on various topics that range from COVID-19 resources at the local, state, and federal levels to finding virtual emotional, educational tools, support for our senior community, virtual substance abuse support groups, virtual mental health support, and virtual opportunities for thoughtful service. What makes this guide truly unique is that we're working with all of the sectors in the community to gather resources for it, and it is updated frequently. And then all of these sectors share it with their constituents, so it has a far reach. The guide is available on our website, allianceforsafekids.org, and a link to it will be included in your follow-up email as well. And if you have not already done so, please follow ASK on social media and add yourself to our email list. You may take care of this right on our website, again, allianceforsafekids.org, and the option to sign up to receive our emails is right on the homepage, as well as all of our social media links. This will allow you to receive updated information on our virtual programs and resources that promote youth mental health, substance abuse prevention, and opportunities for thoughtful service. Again, thank you for your time, and I wish you and your families good health.
Is it possible for me to say one final word?
Absolutely, please.
I would like to thank all of you for joining us tonight, and thank you for your patience. This is the first I've ever done anything webinar-wise or PowerPoint-wise remotely, so thank you for your patience. I want to thank Trissy Kushner, Liz Talbert, Kira Brunner, Juliana Caputo, the entire ASK board, who's have really helped to make this day happen. And I especially want to thank Patrick Talbert, who has been our personal IT guy, and we could not have done this without him. Thanks all of you, and again to all of you out there for joining today.
Thank you. Before we go, I just realized that I forgot to mention one very important thing, that immediately following the webinar, you will be redirected to a survey. And I implore you to take a few moments and answer the questions that will help us to learn how to continue to build new webinar topics and to really improve this series and be able to bring you the information that you want to hear about. So again, just a few moments of your time would be so appreciated. And thank you all so much. And thank you so much, Stephanie.
Thank you.